Hi there. I'm hoping, Dr. Henry, that you might be able to provide a little more context on people who are dealing with long-lasting symptoms due to COVID. In the briefing, you talked about, people who are being impacted by this disease around sort of mortality and morbidity. But talking to the BC CDC, it sounds like they don't really have a good handle yet on how many people are being impacted either by long-lasting symptoms due to a COVID infection or by other health impacts due to the disease.
Yeah, so, those things the clinical data is something that is challenging. There's no single place that we have the information on everybody who's been infected. But we do have a number of clinics in communities, particularly in the Lower Mainland, where the majority of cases have been, and they are collecting that ongoing information and working with, in the study scenario, being able to understand what sort of things work to help people get through those long symptoms that people are experiencing. Yes, that's not something that we have ready available information on an ongoing for everybody that's been affected. We do have a number of programs that are set up to support people, and I know there's several hundred people that are involved in those. And we are looking at the literature from around the world to help us understand, what are the common symptoms. The things that we do know are that people who have more severe symptoms early on are more likely to have lasting symptoms, but we're learning as we go about that as well. We don't know how long it lasts for some people. We know that it's months now for many people, but we've only known about this virus for a little over a year. So some of that is still trying to be understood both here in BC, across Canada, and with study groups around the world.
Follow up, Shannon?
Yeah, so information and research coming out of other jurisdictions suggests that approximately 10% of people who are infected with COVID will have these long-lasting symptoms. Other estimates indicate that for people whose illness is severe enough to require hospitalization, that number could be as high as 30%. Given the way BC's cases are going these days, that would be upwards of 50 people a day developing long-lasting symptoms. In your daily briefings, you generally mention how many people are considered recovered. The health minister has suggested that you're also providing information on people experiencing long-lasting symptoms. I haven't been able to find that information, but I'm wondering at this point, do you agree with do you think BC is seeing similar numbers to what is coming out of other jurisdictions? And do you have a plan at this point to start providing this information, given we've now been in the pandemic for a year?
Yeah, so as I said, that's not the information that we actually, individual clinical histories are not something that I have access to on an ongoing basis. And the clinicians who are caring for people, for the individuals who are going through this, whether it's in hospital, the ICU, and their family physicians, and now the series of clinics that we've set up, those are the people that are collecting that information to help us understand for the population here, and they're connecting with the same types of study groups that are happening around the world where we're trying to get a better understanding. We don't yet have a standard definition of what we're talking about. So when we look at some of the studies, and I read these as well to try and understand, they are looking sometimes at different people. We know that anybody who is in the ICU, there's a period of time of recovery that can last a long time, no matter what the cause was of them being in the ICU. So it's unclear yet if it is directly related to COVID or if it's related to the trauma that happens when you're in a life-threatening condition that requires you to have intubation or to be in the intensive care unit. So these are all phenomena that are being addressed by the clinicians, and we will be part of all of those studies both here in BC and across the country to put together that picture over time. So I don't have that data. It's not like we're not sharing it. It's we don't know. We don't have any means of following up on every individual person's recovery over time. So those are the things that, yes, it's part of an ongoing research and study, as well as providing clinics where people can get the support that they need.